Did I lose you guys again?
I'm getting you.
Okay, I didn't hear
Hi,
the last thing that Aisha said before she left.
We're live, I think.
we're
We're
actually
live now.
live.
Yeah.
Okay.
Yeah. So hi and hello everyone. Welcome to the South Sudanese Women Intellectuals Forum, and where we discuss South Sudanese issues both in the country and in diaspora. My name is Juan Mule, and I'm going to be the moderator for the topic of today, which is mental health and its impact on the South Sudanese community. With me, I am honored to have our just appointed Minister of Health. I'm so excited. Congratulations, Minister Yolanda Awel Deng Judge, who is going to be talking to us about mental health. She's in the house, and I'm so excited. And on the list of panelists, also we have Miss Lily Basaronga. I hope I pronounced your name the right way. Yes, and also she's going to be talking to us more about mental health. We have Ms. Nyamuch Lok, who is also going to talk about mental health. Well, we do have other panelists who are not on board right now, but they might probably join us in the course of the discussion or not. For that case, let me allow my panelists to introduce themselves. Honorable Yolanda Welding, Judge, can you hear me?
Yes, I can hear you, but your volume is too low. But I'll try and move closer so it will be my face in the front of the camera.
Oh, thank you so much. So I was just trying to introduce our, panelists to the audience, and I'm asking you to kindly introduce yourself in full, besides being the just appointed Minister of Health. Thank you. We can start with you, Honorable Yolanda.
Thank you, everybody. Thank you, Joanne. And thank you to this women platform for availing this opportunity for women of South Sudan. I am highly grateful. My name is Yolanda Wildeng Judge. I am a South Sudanese who is also a psychologist. That's mainly what I actually do, and that's my passion. And I'm here in Juba. Thank you for this opportunity. Thanks.
Thank you very much, Honorable Yolanda. Well, thank you so much. We appreciate your service to the country. Next is Ms. Lily. Can you please introduce yourself to the audience? Thank you.
Yeah. Thank you so much, Joanne. My name is Lily Basaronga. I'm a gender and health specialist. I'm a South Sudanese. I live in Diaspora. Thank you.
Awesome, amazing. And we have Ms. Nyamat. I hope that's the right pronunciation of your name, please. My apologies if I didn't pronounce it rightly. Yes, please introduce yourself.
Okay, can you guys hear me? Okay, thank you. So my name is Nyamuch Lok. I'm a South Sudanese, and I'm a master trainer on the strategies of trauma awareness and resilience. That's what I do in the field. Every day I go out there and I talk to people about the unhealed trauma that everybody is facing in the country and everywhere else. So I'm grateful to be part of this great conversation, and I'll learn more from my colleagues and the people who are here. And thank you so much. I'm in South Sudan.
Okay.
Oh, thank you very much. Can you all hear me?
Yes.
Oh, okay. Amazing, amazing. Yes, as we all know, these are people who have experience and knowledge on the topic mental health. Personally, I am a mental health advocate. I would love to know more and to get to know more about mental health and how it affects the society we're in. A report in 2017 indicated that at least 792 million people lived with mental health disorder of some kind. That could be about 10.7% of the population globalized. So we get to see that indeed mental health is a very, very big issue. And coming to the context of South Sudan, it is written by researcher One Low Joseph, who has been working for the World Health Organization, according to the report. He said that South Sudan is has one of the largest mental health gaps in the world. And the World Health Organization estimates that during humanitarian emergencies, rates of mental health disorders can increase up to 4% for severe conditions and up to 20% for mild to moderate disorders, which require care and support. Well, so that indicates that at least in his conclusion, that 1% of those that are attended to during humanitarian assistances not really 1% of these people get that support. That means 99% of the South Sudanese who are having mental health disorders are actually at a risk. And that brings me to the question of what we can do as people move forward to see that mental health is upheld in our society. Yes, and that being said, as a mental health expert and also a gender expert, my question would be, how does gender relate? What is the connection of gender and mental health? If you don't mind, Honorable Yolanda, can you hear me? You seem not to hear what I'm saying. Can you hear me?
Yeah, I can hear you.
Oh, okay. Thank you very much. Thank you very much. Well, yes, I am asking, maybe I can ask Lily, since she's a gender and health and mental health specialist. So can you tell me what's the connection of mental health and how do you define mental health in your field? How does it connect with gender? Thank you very much. Could you please unmute yourself? Yes, thank you.
Yeah, thank you so much, Joanne. It's a pleasure to discuss. It's a very important topic today, and it's something that we are living with in our life in different ways. We experience in different ways. I will simply define mental health as it's emotional, physical, or social well-being. It affects the way we think, the way we feel, the way we act, and the way we relate to others. It is also to others and be able to handle the stress. We live with the stress in our daily life, and it affects every individual at different stage of life, from childhood, adolescence to an adulthood. What is the mental illness or disorder? In most cases, is a condition that affects our thinking, our mood, or the behaviors. For example, depression, anxiety, bipolar disorder. This affects ability to relate to others and be able to function in our everyday life. Gender is connected to prevalence of certain mental disorders, including depression, anxiety. For example, women are likely to be diagnosed with depression compared to the men who is diagnosed with substance abuse, or at times the antisocial personality. However, mental health affects both men and women equally. And if you see, it doesn't discriminate. Mental health affects young, old, both male and female. So that's how I can relate the mental health to the gender. Then how does the gender affect or the health in terms of access to what can be done about? I think that's how it was the question. How can be done about it? In most cases, gender stereotype affect the way people respond to others, especially a person whose symptom was stereotype associated with other women or men. For example, men are likely to be stereotyped as violent. That often linked to something like alcohol abuse or sexual abuse, while women are stereotyped to be to issues like depression, because we women mostly we suffer through, we go through a lot in our life. We are abused in our life, in our adulthood or in our childhood. So this mostly we hold a big heart, and in most cases you find that women are associated with depression. And according to our norms, in our societal norms, men are taught in our society not to share their emotions, not to show their symptoms. So in that case, men tend to men tend not to go to access the health care or the help that they need, because they shy away because of the stigma, because in the society they are not allowed to show the emotion. It's a kind of weakness to the society. And in most cases we find that there are only few men, like 1 out of 10 compared to 1 out of 4 women who have access to the health care in their lifetime. However, mental health problems affect both men and women equally. For example, women, like in their lifetime, they have been abused, they have gone through a lot in their childhood, maybe like in their marriage. But however, most of the treatment is very sensitive here. When you want to handle the health care, you have to make sure you handle them equally, both men and women. You have to treat them, you have to find a way, because it's a very sensitive issue. So you have to make sure the way you handle women should be different from the way you handle men. For example, when you go to the hospital, if you find the doctor is not a female, then definitely there are going to be biasness. So we need to be very sensitive, and we need to know to get a provider who will not be biased to both parties, and they should treat them equally, the same way they would treat men or female at the same time. Thank you. I think I can also go ahead and I think since our moderator has dropped down, I will go like, how can we as women navigate the stigma against mental health? Mental illness is not a character defect. There are so many reasons why people develop mental illness. Some are generic, some are biological, some are as a result of the child trauma or overwhelming stress at school, work, or home. So sometimes you find that our environment, the injustice, the violence against individuals affects our mental health. So I don't see any reason why the society should be biased to only female. There are so many, we have to understand there shouldn't be any fear in understanding the prejudice against people with mental health or addictions. And simply how women can navigate stigma. I think here we need education. In most cases, we need to really understand ourselves as women. We need to be strong. We need to know our emotions, and we need to support ourselves, and we need to ask for help if there's any need. We need to ask to get the right treatment at the right place. We don't need to sit back. We need to be aware of our attitudes. We need to examine our judgmental thinking, reinforced by upbringing and society. We also need to choose very careful the words that we use to others. Like, for example, other women, when you are mentally sick, they will tend to ignore you. They will not be there for you. Instead, they will start gossiping you instead of helping you. So we really need to be very careful. We need to educate others. We need to be positive. We need to challenge the myth and the stereotypes against us, because if we don't challenge it, we will live with it and it won't help us. We also need to be positive. We need to focus on our mental illness. Like, there's much more out there. There's a big picture of mental health, but if we don't focus and take it positive, like it's just a sickness like any other disease. For example, like cancer right now, That's the same way also the mental health should be treated the way we are treating the cancer. It's not only cancer. We have mental, especially women, we don't speak up at times, like our society, they don't allow us because kind of the stigma we carry, because as a woman, even if you're going through an abuse in the house, you're not supposed to say it because it's like you are not maybe handling your home very well. That's why you are not able to take care of your kids or your home or your husband. So you just die silently into that. But this is the high time for us to get out of that. And many times, like, we believe that the mental health is not something which is natural, or it's not something that is which is spoken about it in our society. We don't talk about it. But this is high time for us to know that the mental health we are living with it is something among us that we need to get rid of it in our society. We need to get this belief of, oh, it's witchcraft, because in most cases, our people believe that mental health is just witchcraft. Some maybe have wished you, or maybe have been cast in the community, which is not true. The reality is we are living with this. It's a mental health. It's a mental issue. It needs to be handled like any other diseases. So we really need to be positive about it. We need to seek treatment. We need to treat everyone equally with dignity and respect. We need to offer encouragement to our sisters. Those ones who cannot speak out, we need to find out how they are doing. If we don't, let's reach out to them. Let's stop this thing. Oh, maybe she's not mentally sick. Maybe she's not doing well in life. If she's not doing well in life, how can we help her? We should not ignore her. We should be in front. Let's support ourselves. Let's get rid of this stigma of the society will look at me like that or that. No, let's think positive and let's try to support ourselves. If we don't support ourselves, there's no one who's going to support us, because in most cases, if you find most of the women, they are stressed from their husbands in the house, and the men will never be there for you. Instead, they will just abuse you. They will abuse you more and more because you are not able to support yourself. But reach out to your friends. If you don't reach out to your friends, then you cannot be able to get help. So with this, I think I will stop here, and thank you so much.
Oh, thank you very much, Miss Lily. That was very elaborative. And thank you so much. I appreciate. My apologies. My internet connection has been on and off, and that's why some of you might not have been able to see me. And also, I have not been really saying how gross. Yes, so Honorable Yolanda, let's understand, based on what Miss Lily has just said, let's understand something. Because we all understand that the outbreak of the COVID-19 really did cause a lot as far as our mental health is concerned. So from your point of view, how can we continue to protect our mental health during the COVID-19 crisis and the conflicts in South Sudan?
Thank you for having me once more time. First of all, realization and acceptance that our mental health suffers some time is very crucial, and it is the first step. And then normalization of mental health struggle is the first step to protecting our well-being during and after this global pandemic. It is absolutely okay not to feel 100%, but after noticing the psychological, emotional, and physical changes that I'll talk about shortly, it is important to actually realize this thing and begin to kind of seek help immediately. As we know, COVID-19 has so many impacts. It has impacted us, like our mental health, our social welfare, our economical welfare, and all these things are kind of holistic. They go hand in hand. And then secondly, our country has seen several conflicts, both the natural disasters like floods that just happened in the wilayat, or famine, or human-created conflict like communal fights or civil war, the several civil war that we had. So our citizens during this time actually developed and continued to be very resilient as the nation underwent several encounters. Tapping into what makes us resilient, protect our mental health during this trying time, because resiliency is part of our coping mechanism. So sometimes we need to sit with others in difficult time and empathize, which allow them to be seen and heard. Other times we need to point out that their strength, and this will grasp the light that we show them, and they kind of persist. Thirdly, there are some simple tips to protect our mental health. For example, find time to relax, especially like as women, when you leave from work, for example, Joanne, you will go and you go. You go clean the house, you go cook, you go do that, you go do that. You need to create time to relax. And also, most Junubin, with our economy right now, people find it very difficult to actually find simple pleasures. For example, if you used to go, for tea time with your girlfriend, it is difficult now to do that because the economy is too hard. But it is important to find simple things, even to find time to go for a walk, find time, to enjoy, your best music. Doing these things lower your stress hormones, and when your stress hormone are lowered, which is cortisol, yeah, your feeling happy hormone, which is serotonin, will actually be raised. When these one are raised, your mental well-being is actually a little bit aligned. And then another one is keeping clear of boundaries. Do not carry work home, or do not carry chores or activities from home to work. Keep clear of your boundaries. And then another one is to look after your body, self-care. Find time to shower properly. Don't just rush to the bathroom, pour water on your body, and then go. Find time to do self-care. Find time for those who meditate, for those who do yoga, for those who go to church, for those who use praise and worship. Find those small time to do self-care. It will actually enrich you physically, emotionally, spiritually, and psychologically. And then restrain or take a break from news that invoke anxiety. Every day is a bad news. We have got fighting here. We have got this one here. Somebody's bombing somebody. Somebody got killed yesterday. There's a known gunman. Try to keep away from the news that create fear in you. Try to keep away from the news that invoke anxiety, and also the news that will make you feel uncertain, will make you feel hopeless. So with this one, with these few comments, these are the things that I can recommend to be ensured during this time of coronavirus, as the coronavirus pandemic is continuing, and after coronavirus. Thank you.
Amazing. Thank you very much, Honorable Yolanda. So what are some of the signs or indicators that somebody probably is going through mental health issues or mental health breakdown? What are those signs and indicators?
There are numerous signs or indication or symptoms, and I normally divide them into three categories. There's physical, emotional, and psychological signs. And sometimes they can be minute. For example, this sign, you will feel headaches or body aches, without a disease like, let's say, malaria or typhoid, but you just feel this thing. Sometimes you'll have got excessive night sweat, when you don't have a pathological condition or weather changes. Now it's very hot in Juba. So we are feeling hot in Juba. It doesn't mean that you are depressed or stressed. But it could be the weather. But when the weather is normal, like yesterday it was raining and you're just sweating excessively, it is one of the signs. You're feeling anxious, or maybe there's this nerves to be jumpiness. You're kind of feeling jumpy, you cannot control yourself, and you're kind of an ease. And then faster heart rate. Another one is fatigue. You are exceptionally tired. There's nothing that you just want to sleep. And then you might have digestive issues. Okay, I lost your ability there, yeah. And then maybe exhaustion, nightmares. So these are just benign. Sorry guys, I just keep on getting interrupted here. There's a phone call coming through. So, and then, but we need to realize that these symptoms that I just talked about, the one that I just outlined or highlighted right now, differs from person to person. It is not a one all fit sort of symptom. They kind of differ. But here are some of the symptoms that you need to watch out. The symptoms that have escalated from it just being a simple, you are off today, and then you feel it, and then you do the self-care and the break and all this kind of thing. Then you are kind of back to the system. Some of these symptoms, like different types of eating disorders, they could have this type of anorexia or bulimia, or changes in personalities. Like you are a very quiet person, but right now you're all of a sudden your personality type has changed. You are very talkative like me. You are very, outgoing, or maybe you had withdrawn. Like you don't want to go to the public. You are isolating yourself. And then, like, inability to cope with problem or daily activities. Like, for example, like if I used to like going to the market every morning at 6 a.m. or maybe going for a jog, right now that thing has changed. I don't feel like I want to do it anymore and things like that. Or maybe you have got attention issues that you cannot concentrate, you cannot finish that project, or you cannot finish that report, that like the deadline is coming very closely. It's one of the signs. Or maybe you are worrying uncontrollably. You are just very much worried. You are sitting down, you are worried about the thing that like are not like there. And then your pattern of sleep has changed. Like the amount, you are either sleeping too much or you're sleeping too less. And then feeling of disconnection or withdrawal from normal activities. Like, let's say if I'm part of the thing group on Sundays, I don't want to be involved in that activity anymore. As I mentioned earlier on, either you become isolated or this type of thing. And then you have got this unusual or magical way of thinking. You think all of a sudden that you are going to fix all the problem of the world. You are going to be the super lady or the superman or this kind of thing. And then excessive anxiety, is one of the symptoms, or prolonged sadness or depression and empathy. When these symptoms, you do your personal evaluation, I'll talk about it later on. When you do your personal evaluation and you realize these symptoms, you might need to actually see somebody or seek help or try to look for some intervention. Thank you.
Thank you very much. Talking about intervention, when you realize that you are actually having signs and symptoms of possible mental health disorders, what, Honorable, would you advise? How can this person seek for help?
There are several steps, like that somebody can seek for help. For example, I would say like there are maybe 4 steps. The first 2 steps are more like of your own personal evaluation, and the last 2 steps are actually getting professional help. For example, like the step 1 is the recognition and acknowledgement that one's mental health is suffering after personal monitoring and evaluation of patterns of behaviors and changes in your body. This alone is a huge move forward to getting help, considering the stigmas that Lily, I think, talked about earlier on, and labeling. Our society, and I will not say it's only the South Sudanese society, with my experience with working with mental health or mental care system in Canada, we realized that the minorities communities, or let me call it like the ethnographic communities, actually have a huge stigma with people suffering with, with these mental health illnesses, or even accepting it, or even talking about it. It's almost like a high situation. But the good news is we are a little bit breaking away from that. So, the most important thing, as I mentioned, is actually recognizing that you need help, because feeling powerless to overcome mental health is the beginning of getting help. That's step 1. Step 2, when you realize that, your mental health is actually not aligned properly, as I mentioned, you reach out for help, either from a trusted friend, family member, colleague at work, or any positive person that can provide a safe space for you to vent. It is important because sometimes people who actually ended up pulling through with suicide are individuals who did not get that support. Venting out, when you really vent out, it helps you. If you are having suicidal ideation, or maybe suicidal thoughts, or maybe you had a plan to carry out suicide, and you go vent, it is very important. You might find a turning point. And what is the turning point? It could be your daughter, it could be your friend, it could be that old lady who you are going to buy Korofa from. You talk and they will say something that will actually, pull you out of that dark hole. So that's step 2. Step 2 is trying to vent to somebody that can provide you a safe space. And then, as I mentioned earlier on, the next 2 steps step 3 and step 4 are actually moving toward getting professional help. For example, step 3 is you need to get a proper diagnosis in your communities. Avoid self-diagnosis. And again, I repeat, avoid self-diagnosis. Internet is full with so many things. Other people ended up like killing themselves because of what they went and Google themselves. You go and find something and somebody's there on the internet without like, guidelines and rules and all this kind of thing. And you think you have it, but you don't. So trust your own small services that you have, like in your communities. And I do acknowledge that South Sudan, we are still struggling like the rest of the developed countries in regard to mental health services. We do realize that, but at least we have something. We have got something that's been offered by NGOs, like where Lily is actually specializing. We have got South Sudan Council of Churches that are doing that. We have got Crown the Women that are doing that. We have got so many local NGOs that are actually giving a little bit a small scale mental health support. Try to fix those, instead of you sitting and doing self-diagnosis again, as I mentioned, try to go seek for professional help. And then step 4 is getting a treatment plan, especially tailored to you. Clients or patients are different. I might be having anxiety. My friend might be having the same type of anxiety, but the level of treatment is different because I have got different personality type. I have got like mode of doing things and things like that. I have got my own so get your own treatment plan that's tailored to you. So this is what I can say about steps, to getting mental health. And coming to counseling help a person by reinforcing positive self-image. When you go to counseling, like most of the clients that I see, when they come and we have got sessions, I could have got 3 sessions, 4 sessions with them. Like, the way that I saw them during the first session, if they pull through with their own tailored treatment, by the time we are done 4th session, they have actually changed a lot. Like they will even be like, doing things by themselves, and then they lead you along, because my practice is a client-centered practice. So again, doing counseling help with self-image. It will also reinforce useful self-beliefs. Like as Lily mentioned earlier on, that we have got this belief.
Hello, Honorable Yolanda, can you hear us? I think we've lost you, but we'll get back to Honorable Yolanda. Well, let's get to know something about trauma. Trauma is one of the mental health, one of the most. Yeah. Can you hear me?
Hi, can you guys hear me?
Oh yes, thank you. Welcome back.
I don't know if you can hear me, but anyway, I'll finish what I was saying. My internet is so bad. So counseling help also, it gives you a secure, comfortable space to feel heard, to feel safe, and also it help to guide away from negative thinking. It's kind of channel you to kind of go through your challenges like in a very positive, supported, and guided way. And then additionally, counseling relief from depression is also relief from anxiety and other mental health conditions. It increases confidence and decision-making skills and ability to manage stress effectively. And I'm hoping that you guys are hearing me.
Yeah, we can hear you.
If you are hearing me, give me a thumb up.
We can hear you. Honorable Yolanda?
Yes.
Yes, we can hear you. Okay, we'll get back to Honorable Yolanda later on. So trauma is also one of the mental health disorders that is actually affecting most of the South Sudanese, both in the diaspora and in the country. That is mostly because of the conflicts and wars that we have gone through. So Ms. Nyamach, could you please kindly tell us more about trauma and some of the factors that can lead to this very, vice that I call a virus, trauma. Thank you. Miss Nyamoch?
Yeah, thank
Can
you.
you hear?
Can hear you now. I was trying to unmute myself and it's a little bit
Thank you.
tricky. Okay,
Welcome.
thank you so much, Joan. I hope all of you can hear me. I wish Honorable was here. I'll just like to mention something on, now she's the Minister of Health, and I hope the mental health department is going to do better since she knows about all these things. So thank you. I'm going to talk about something about trauma, and just like as some people have already mentioned about mental health, is just like a physical wound or any other disease. So people ignore this. So first of all, I'd like to define what trauma means. Trauma, when we need to define what it means. So we can define trauma as trauma. It's we can define as an emotional wound or something that happened and leave you shocking, painful, harmful, and it's leave you overwhelmed or threatened. This is abnormal, something that abnormal abruptly just happened to you, and it's leave you overwhelmed. So there's a lot of factors or a lot of trauma causes, especially in South Sudan. Today we've been in wars and nothing was done. So a lot of people have the unhealed trauma. So the unhealed trauma itself, it's causing more trauma. So in our community today, we can talk of causes of trauma. First of all, we have the revenge killings down there on the ground. Revenge killings are one of the things that is taking guys back to the cycle of violence day out, day in. We have the natural causes. We have floodings. We have famine. We have things like lightning. Those are causes of trauma. They are natural. And we have wars. One of the things that we know in decades in South Sudan, we've been in wars. So war is one of the major trauma cause in South Sudan. Another thing can be for us women today, there's domestic violences. So it's another cause of trauma. We have things like abuse, sexual abuse, rape. So these are things that can also cause trauma. We have accidents. We have long illness. If you sick for a very long time, it's one of the things can cause you trauma as well. We have things like tribalism. We have poverty. So these are things that that causes trauma. Today, in every day of our life, we are facing trauma in many ways. Many incidents are causing trauma in our daily life. Thank you.
Can you hear me? Yes. Thank you very much for that elaborative, discussion on what causes trauma. Now, what is the relationship between trauma, mental health, and suicide? Because of recent, we can tell from, especially this year, 2022, from January till now, there has been a rapid rise in the cases of suicide in the country, not only in Juba, but also in other states. The newspapers have written a lot, and I really, really think it is something so much connected to trauma and mental health. So how do these three relate?
Okay, thank you, Joan. So it's happening like there's so many cases of suicide in the country, and it has to do with the trauma as well, mental health issues. So the thing is, when we talk about trauma, there's where we talk about when something happened, our reaction are different to a traumatic event. So people respond in different ways. So when something abnormally shocking happened to you and leave you overwhelmed, your brain is always bypass a thinking brain. So in trauma, when we talk about the local context about trauma, we always divide the brain into three parts. We have the thinking brain, we have the emotional or feeling brain, and we have the survival brains. So it happens, these different types of brain, they have different works. So the thinking brain help you to make decision, you evaluate, you plan. Emotional or feeling brain is the center of emotions, anger, happiness, sadness, fear. And we have the last one, the survival brain. So what survival brain does is to save you, maybe protect you from what can happen to you, because it doesn't know the time. Survival brain want to help you to get away from the trauma. It has the three reaction: freeze, flight, or fight. So what always happens when individuals are in traumatic experience and they're using the survival brains, when they are not helped to regulate back their brain to the thinking brain, high chances of them committing suicide, doing what they want to do, are very high. They are in the risk of doing that because of nothing is done to them. There's something we always call emotional first aid. When something happened to you, just like when you cut yourself, you need to do some first aid for that wound not to be maybe big. For individuals who have event of trauma, when they are not given the first emotional first aid, chances of them doing whatever they can do, risk they can hurt themselves. These are cases of suicide. So when people are traumatized and nothing is done to them, like things that Honorable mentioned and Lily mentioned before, so it's happened like your brain is not regulated. Brain is always want to be regulated back. They talk of exercises, you need to listen to music, you need to be connected to the loved one. So these are the things that can lead to suicide if your brain, because it's just the brain that help you to maybe think. If you just think like, I'm going to kill myself right now, and nobody is there to tell you this is not the right thing, and your brain is not functioning well, so high chances of suicide will always be there. Thank you.
There has been, lot of, there have been lots of statements, out there about self-defense violence. So I would like to know, do you agree with the statement that say probably the reason as to why self-Sudanese, are very violent? For example, we just had one of a very promising young self. Can you hear me?
Yes, I can hear you.
Yes, Lily, can you hear me? Yes. Okay. Lily, can you hear me?
Yeah, I can hear you now. You were kind of cutting before. Can you go over again, please? Thank you.
Yeah. Thank you very much. Yes. So, Ms. Nyamot, I want to know something. So there has been a lot of violence, among South Sudanese, especially in the diaspora. You go to countries, and in these foreign countries, you find that South Sudanese are fighting each other. For example, of recent, one of the South Sudanese Australian who was murdered in the sports, was murdered by a gun in one of the states in Australia. And it is said that it was a gun-related kind of, confrontation. So that indicates that South Sudanese are actually violent according to the image they put out there. Would you agree with the statement that says South Sudanese are violent because of the long-term trauma that they have undergone through because of the war?
Yes.
And what can be done, curb this trauma, control it in the South Sudanese communities, both in diaspora and within?
Yes, thank you so much, Joanne, for that question again. So I always say violence causes trauma and trauma causes violence. So when people are not healed or people are having the unhealed traumas or an ill wound, it's these chances of you will either act in or you'll act out. So you acting in, you'll hurt yourself. These are the cases of even suicide coming. This case of people using the drugs. So you acting in because you have that unhealed trauma. The other way is you acting out. When you act out, you're hurting other people. trauma, hurt people, you're hurting people. So because of this long-term trauma and nothing is done, we talked of causes of trauma, bad news every day. We hear about things that there's a lot of things that hurt us day in, day out. So when we have the unhealed trauma and we still have the bad news, so it increases chance of having this thing of mental or more trauma. So for us, the most important things is that what we need to know as South Sudanese is this trauma. It's people need to know this illness. Like, people need to be given the awareness. What are the harmful thing about trauma? It's just like any disease. If you're sick, you need to seek medical doctor. When you're traumatized or when you feel like you're not in your mental stable, you're not mentally stable, what do you have to do? People ignore. People don't want to visit these things. Like, it doesn't matter to some people. It's just like, oh, our close relatives, our friends, our families doesn't take these things serious because that's how it is. It's even come with a negative how do you call them? It's negative. People see it, it's very negative, like people don't care about what is going on. But you acting out, you causing more trauma to other people and to yourself as well. So this is why we say when you're not healed, you'll act out, hurt people everywhere you go. So it's just about, we need to make people aware of trauma is a bad disease. We need to get out. People need to know the harmful impact about this trauma. Thanks.
All right, thank you very much. Thank you very much. I really appreciate that elaboration. Well, we have Honorable Yolanda's network is not really so cool. It's unstable. It's on and off. I don't know if Honorable Yolanda, you can hear me. Honorable Yolanda? Oh, she's off again. All right. We can get to know more from Lily. Lily, please tell us more out of your your experience with mental health for those in the diaspora and the commonest causes of mental health issues. What are the commonest causes of mental health issues in the diaspora?
Yeah, thank you, Joan, again. Yeah, mental health in diaspora is very challenging, as the same as in South Sudan, I would say. For example, the most causes that I see with our mental clients in diaspora is, the new environment that we are exposed to. Back home, we came from the war, and the way things were like happening back home was from different. And when we come to diaspora, it's a big shock with all the trauma we have coming to a new environment with a new culture, the way things are done in diaspora. For example, in diaspora, things are done in a very professional way. It's all about training. Everything you have to go through training, which is not what we expect to happen here, because like some of us, maybe like we came when we were educated, you're highly educated back home, but when you come here and you think, oh, it's going to be a bed of rose for you. And turns out that the job you are doing back home with all your qualification is not the same that it's not the same. Like, for example, you are a doctor back home. When you come to diaspora, you're not going to be the same doctor, the same work you used to do back home. So this is really a very big challenge to us. You find, I was a doctor, and I assume when I came here, I'm going to be a doctor as well. And turn out that, no, I cannot become a doctor. Then this all of a sudden, of course, affect our mental health, and you start struggling on how to get, first of all, the training that it needs you to be equipped with, to get the right skills to where you want to go. And this takes a while for you to go. And some of us, you find we get so demoralized because, like, oh, I was a medical doctor back home. How can I come, maybe, for example, become a housekeeper? For instance, it's just an example I'm giving. So it's kind of very challenging, and you find that people are so depressed, and it leads them to substance users. For example, men, they end up drinking, and you find they're going down. They can't do much for themselves. At times they are stuck in their house, and if they're gonna go get the job, they might not be really very active the way it used to be. The other one also is like when they stay long, like on the substances, they are lost in the community because it's very hard to fit in the society, which is new because with all the challenges you're going to face, at times you find that the language barrier is a big problem. You can speak the language. Back home, for example, we're speaking Arabic, writing Arabic. We went to school in Arabic. When you come here now, you want to do something for you, you have to get somebody to help you to where you want to go. First of all, if you want to go for the interview, you have to go with somebody who's going to interpret for you. And this is really affecting our people. At times they find out like, oh, I'm not going to do this. So they end up staying home, ending up doing what they're not supposed to do. And this is a very, very big challenge to us. The other one is like discrimination. It's a big stigma that we go through. At times you find that you go to a certain society and they might not welcome you the way you felt you would be warmly welcomed. And this also affects our mental health, which is a big problem. The other one is the trauma, as we had from our sister, the trauma we came back home. At times you find that the trauma, it affects the kids. For example, if the parents are using the substances and there's abuse in that family, you find the kids are so depressed. They can't do much. Even when they go to school, they still think of what happened last night at home because the environment they're living in is not. And yet they don't know what the parents are going through. The parents are going through the trauma that they have, and they're trying to cover it by using the substances, and the substances is leading them to have violence in the house, and this at the same time affecting the kids. And in most cases, you find that kids try to run away from the house when they just like praying when they get 18. Once they get the age of 18, they're out of the house, which is a big problem. And at times, the other one is like long-term physical health condition. You know, when we came with our trauma, if we don't have access to medical treatment, we end up like not doing well. Some of them end up like they don't eat the right food. Like back home, we used to have our traditional meal. Now we get here, at times we cannot afford it because it's very expensive. So we end up going for the fast food, and with the fast food, it affects our health. And this makes us like most of our people, you find when they are aging, like the age of 40 to 50, most of them are diabetics already. They have high blood pressure. They have all these diseases on them, and they're living with it, and it's affecting their mental health. At times they feel they don't get enough maybe to eat, and they don't have enough income. So they end up using those fast food, even giving to the kids. You find the kids are like big in the size. And at the end of the day, all these issues is really not helping us. And the other one is inherent it's biological, it's in the gene, like the bipolar. They find people are really suffering from bipolar, but they don't accept it. This is the challenge we have, and we have our people who are really going through a lot. They don't want to go for treatment. They don't seek help. They stay in the house, but it's something that's running from the family. And you find maybe one of the child also developed the same bipolar. But once they don't get treatment, it becomes a big challenge into the family. You find somebody mood changes. This morning, the wife was fine. She was doing everything okay. In the evening, she has changed completely. You find she's throwing things everywhere. She's not happy, and you don't know why this is happening. Or vice versa with the man or with the children in the house. But they don't take time, and when you tell them, they don't accept it. And at times, some of them, they literally refuse that, oh, I have an example that one of our people in the community, we knew, we identified, and this was the problem. We tried to help, even we consulted the church, and the church came in and trying to help this guy. And the guy said, no. He said, all you guys, you just want to kill me. There's nothing like that. They even paid for him to go to the provider to be diagnosed and be treated. The guy refused. He said, no, whatever you're talking about is not. And he keeps on having problem in the house. Until now, they don't know how to help him. It's out of hand. He's living with it Today is okay, tomorrow is fine, another day is beating up the wife, the children in the house, every day is police in and out, you know. And if you don't accept it, there's no way we're going to help you. And this is a big challenge because it's in your gene. You need to do something about it. You need to seek the medical providers to help you. The resources are available. If you cannot talk to your wife, you need to talk to at least a friend, just like what you guys were saying. So this is has been a big challenges, like with kids growing up, facing the violence in the house, experiencing it, and it's affecting mentally. Going to school, they're not performing very well because of that, and the parents, they don't even think of to look for the solution of what is happening. And also you find that at times, like loss of a family member, when they lose family, it's like, oh, and you know, the life in diaspora, one hand, it's not going to do much. And if you're going to do it, you end up like doing 3-4 jobs to make sure to pay the bills or take care of the kids. If one of the partners has gone, it's a big challenge, and it's a big gap to that family. And you find that if it was the woman who was left, she's doing 4-3 jobs, she's not there for the kids, and mentally she's not doing good. She will never dress the way she used to dress because she's sick and she needs help. And at times she doesn't have, everyone is running up and down. It's all about job, clock in and clock out. There's nobody to be there for you, and you end up being affected by mental health. So far, those are the most things that I found that our people are really facing. But however, you find that there are services available to us. I don't deny it. We really have a lot of opportunity here. We have the in and out patient counseling and doctors who they're always there. We even have a South Sudanese.
Can you hear me? Lily, can you hear me?
Yeah, I'm hearing you very well.
Yes. Allow me to cut you short at that point. We'll come back and then you'll be able to tell us more of these services. Well, Honorable Yolanda's network is very unstable. So I would appreciate if we can, give her a chance just, to answer a few of her questions so that in case she goes offline, we can continue with that conversation. So Honorable Yolanda, can you hear me?
Yes, I can.
Amazing. Well, yeah, from your experience, what are some of the effects of war on mental health in our nation, and how can the community or individuals, participate in reducing these effects?
Thank you, Joanne, and I apologize to the viewers that my internet here is just a hit or miss situation. To answer the question, the impact of several wars in our country are huge and ingrained in almost every sector of our lives. There are some few studies that have been done, and according to my own, when we call it data analysis from my practice, over 48% of the clients that I see suffer from post-traumatic stress disorder, that is PTSD. Almost 60% experience depression, and under 30% battle anxiety. There is some research done to measure the level of impact, like the study carried out by one of my, let me call it like mentor or maybe a pioneer like in mental health. He's based in USA. His name is Niall Tunglam. He's a South Sudanese researcher, and the results that he found are actually worrying, both with South Sudanese in the West, in the diaspora, mainly in USA and here at home. The results are actually very worrying about like the impact of mental health as a result of war. And then there's also another researcher, his name is Moga. He highlighted some vital point about mental health treatment gap in South Sudan, and he publishes his article in South Sudan Medical Journal. There's a need to realistic treatment for individual experiencing mental illnesses on a small scale, because I know our capacity here in South Sudan, as we all know it, the situation coming out of war and then transitioning into many other wars and going through the COVID-19 has actually put health care system in disarray. And I will not say it's only in South Sudan alone. As I mentioned earlier on, most of developing countries are actually struggling. Even in the West, I just came from Canada, not long ago. I had gone to visit. They're like my former colleagues are also struggling. The mental health are actually exploded because of all the the issues that we know. And then there are several ways that our communities could actually help to reduce the effect of mental health, like creating sense of belonging, giving our individuals that are vulnerable social support, and then also like the most important thing that we should treasure is the togetherness that we have as South Sudanese. Like the doing things together, eating together. When somebody is struggling or sick, our communities come together. It is still very common here in South Sudan, although in the West, when I was there, as my sister Lily mentioned earlier on, everyone's running after life. You find an individual is chasing 2 or 3 many jobs and things like that. So that sort of togetherness here and in our society here in South Sudan, it provides buffering and soft landing for individuals that are struggling in our communities. And then communities should be the champion of mental health awareness, because as we have said, it is sort of like a topic that we don't want to discuss. But as we know it, for us to be healthy, our mental health has to be the main determinant of our social life. Like if you are going to function effectively, your body, your mind, and your emotion has to be aligned. If it is not aligned, you'll be out of order. When you are in work, you cannot even think properly. When you are at school, you cannot even think properly. When you are doing anything that you need to do and your mental health is off, you will not be that a billionaire, because you will not know how to make money. So those are my few remarks for that question. Back to you, Joanne.
Thank you very much, Honorable Yolanda. Well, what are some of the challenges that are making people not to acknowledge mental health in our communities, and what do you think can be done, to address this?
One of the main challenges that is facing mental health in our communities has already been mentioned, and I'm very sure is a very common thing for everybody by now. It is stigma and labeling. This stigma and labeling turn away people from acknowledging that mental health exists, and also trying to also recognize that if you don't seek treatment or you don't seek help, it is damaging long term. That is one of the challenge. Another challenge, as I mentioned a few times, is the lack of adequate mental health services. This lack of mental health services, like we have got few, but they're not enough and they're not well equipped. It deters people from coming out to actually seek help, because in some communities, as we mentioned earlier on, having mental health illnesses equate to imprisonment. I have seen some clients here, as I'm sitting here in Juba. I have gone to some client to actually get them in prison because their family members, they don't know what to do with them. And I noticed one of the participants earlier on was asking a question about psychotic disorders. Psychotic disorders are actually the next level. Like if we don't treat simple mental health illnesses or disorders like, anxiety, depression, PTSD, they will escalate. And when they escalate now, you will need a medical treatment. It will not be a psychotherapy or counseling anymore. And when it reaches that level of medical treatment, for the chemicals in your brain to be actually stabilized, you need a psychiatric help. And I know here in South Sudan, one of my good friend and colleague, Dr. Atongolonga Rayuel, she's practicing, and there are days that she's in a university of, in Juba Teaching Hospital. There are days that she's the director of Blue. She's the director, of Blue Hospital, which is for the police, and there are some days that she's at the private clinics, and there are some days that she actually provide voluntary one-on-one, sort of help for patients like that. So these are the two main ones, the stigma and lack of adequate medical services, to kind of address mental health situation. And then the way forward, it is promotion and normalization of mental health in our communities, workplaces, schools, and then some other institution. For example, I talk about my mental health to my family, even my 5-year-old. There are some days he will come and say, Mom, I don't think my mental health is good today. I need alone time. Or maybe I need to do this to make me feel better. You make it normal. You make it normal that to experience emotional unwellness at that time, or psychological unwellness. It's like feeling malaria. It's like having typhoid. It's like having some common thing, and they're treatable. They're not something that like you could run away. There are some days that I feel that I'm depressed, and there's some season that I feel, what, I need to go speak to another psychotherapist, to kind of kick me back in like, in working mode. It's a normal thing. We need to normalize it, and we actually need to create those spaces, in our communities, whereby people come out and they talk, and we should not make people feel unheard. We should not make people feel, unseen, and we should not judge them. Our communities are very full of zolde majnun. Wallahi ta talk bell. Okay, ben case today and say ras ways. We should not do that. And these are the things that, make people to actually hide. And when they hide, you'll wake up one day and find, oh, somebody mad. Oh, I'm listening, or I get an episode of bahar. Because you have reached like your end of the rope. So again, point one, promotion and normalization of mental health awareness in our communities and wherever we are, even in schools, we should talk about it. Number two is bridging the mental health, the mental health treatment gap, to encourage more individuals to seek help. Some people will come out that, I'm suffering, I'm experiencing this, and you go to the clinic. Maybe the clinic was closed 2 weeks ago. Either lack of resources, or the individual there is not there, or one or two, three things. And what do I mean about like the treatment gap? As Joanne, explained earlier on, South Sudan, by the virtue that we came out of so many wars, we have got a huge population that is experiencing mental health and like, struggles from a very lower level to a very high level, and there's no treatment. Like there's no resources to actually like address this, situation. This is what I meant by mental health treatment gap, so, and bridging it, it is one of the way forward to encourage people to come out, to encourage people to actually seek help. So thank you.
Thank you very much, Honorable Yolanda. That was really, really very, elaborative. So according to, let me look through some of the comments. Our audience, some questions to you, Honorable, Yolanda. Someone says, this is Regina Thorn. I do understand you have just been sworn in days ago, which is not true. But I have a question to you. And my question is, what are the strategies in hand for mental health illness, and example in Juba and all those other states? And I think what this person means is what you just elaborated, is hoping that you can, in your position, put these things in place and make sure that mental health is upheld and supported in South Sudan at large. And also some others have also recommended creating mental health institutions across the country. These are all dedicated to you, and most of them are really, really congratulating you for the ministerial position that you just earned. Yes, thank you very much. Let's get back to Miss Lily. Miss Lily, you were telling us about, the services that are available for the South Sudanese community in the diaspora. What are some of them, and could you please elaborate? Thank you.
Yeah, thank you, Joan. I was talking most of the service available. To be honest, we have all the opportunities and to have the access to the resources available. For example, we have the inpatient and the outpatient counseling and the psychiatric. They are available to us if we need them. It's 24/7. If you're just willing, you can get. We have also the rehabilitation centers where, like, when you get treatment, after treatment, you are taken to get back your life. That's why you get the training. You'll be able to like be independent into your community again. You can be able to take your medication. You can be able to get your job. They will train you. That's a process of under rehabilitation. We have all those resources available. But the challenge we have here is the engagement and compliance and accepting the reality that we really live with this mental health and we need help. It's among us. It's a reality. It's just like any medical conditions. We need to seek help for it. That's the gap we have, that in most cases, our people don't want to have. With all the resources available, they don't need. We even have like a South Sudanese who's a counselor that I even work with him. He's available. He can even go to your homes and help you. We have the case managers around us that who knows where all these resources are. If it's the language, we have people who are South Sudanese who are interpreting. We need to go to them and get this. But the challenge is we still don't believe in it. We still don't come forward. However, those who have really accepted and who have used these resources, they have produced success with individuals and they're doing great in the community. Most of them are back to work. Some of them are back to school. They're doing good. So we have all these resources, but these are the challenges, as I said it, with the myth in our community, just like what we have been talking about. And at times, if our community, they don't support us, then like the families, they are not there for us, then that's why we go down. It's a big challenge. But however, those who have really accepted it and living with it, and it's a fact that it's a disease like any other disease, they have got treatment and they're doing better. That's all about the services around us.
Amazing. And what are some of the steps for reintegrating people with mental health issues, back into the community?
Yeah, thank you. Integration is a big task. It's not only for one person. It's not for like individual. It's like a collective responsibility of the community. It passes through the psychiatric, the rehabilitation, the people in the community to help these clients or to help this member community to get better. First of all is accepting the reality that I have and I can get treatment, go for treatment. Two is after getting the treatment, as I said, you go through rehabilitation. That's why they're going to train you. You're going to get all the training available to you. We can also integrate them by collaborating with the churches, with our elders around us, because the community has to take responsibility. The churches leaders have to know, they have to play their part by spirituality, like preaching to them, because some of them really love churches. They would like to go back to the church. So seeing that, they really need all this help from these groups to integrate it easily into the community. The other thing is getting readiness to job. When you're ready with all your medication, you can take your medication, you go through a training. We train them, we train all these clients to make sure they job the skills that they need to get the job. Then we also give them the right skills. After getting the right skill, you link them up with the job developers where we take them for the interviews. You prepare them on how to interview, to be interviewed or to respond in an interview. You train them on how to respond to the people, how to relate to others positively in the community. Once this is done, then they are ready. They are back to the community. They are happy. Like it's hardly for you to realize that, oh, this person actually had this mental sickness. It's just the collective responsibility of each and individual in the community, taking care of one another, and especially giving them the basic skill on how to live a healthy life in a community once again. I think those are the steps so far. If we really handle it very well, we can live that life that we lost, because this somebody with a mental health, you lose whatever you are able to do, but giving it back, equipping that person with that skills, the right skills that they need, and show them love. Be there, be kind to them, understand them, and don't point fingers. When they are in our community, we don't need to point finger at them, because it's you today or it's me today, tomorrow will be somebody else. We just need to work together, make sure we build our community positively and be there for each other. Thank you.
Wow, thank you very much. That means, the solutions are actually at our disposal. It's just us to take the initiative to go and grab them. Well, that reminds me of, the services that the South Sudanese Women Intellectual Forums are having. They have the psychologists, they have the psychiatrists, the counselors, and all professionals, mental health experts are here to support anybody out there. So I think our audience should be able to reach out to the South Sudanese Women Intellectuals Forum, who can connect you to the professionals that you need to talk to. Talking about that, I'm coming back to Ms. Nyamoch. Ms. Nyamoch, we were talking about trauma. So based on your, experience, what do you think are the early signs, that can indicate that someone is at the risk of committing suicide? And how can we, as the community or people who think that somebody is at the risk of committing suicide, what can we do to help this person? Thank you.
Okay. Thank you again, Joanne, for the question. So there's always signs of trauma, or you will notice that somebody has gone through trauma experience or a trauma even after some times. So the experience or signs, one of the things can be even body change. This is whereby if somebody used to be fat or has a body will reduce, lose of weight. This is one sign of trauma experience when you're overwhelmed. The other one can be anger. You become like you don't associate with people. You became so you just want to be angry all the time. The other one can be isolation. If you were somebody who used to be around people and you are affected, so you'll have to be isolating yourself most of the time. The other one can be alcohol. In our community, when something happened, this is one thing I've had in the field. Mostly people, when you're in that traumatic experience or traumatic situation, people will encourage you to drink alcohol. So you taking alcohol, you're hurting yourself, and you will not be able even to think. You'll not even be able to solve that problem. So they are increasing your problem by you drinking. You'll wake up tomorrow, you still have the same problem. So you will see people, somebody who has been through a traumatic experience will be drinking too much alcohol or use of substances. The other one can be, person will be like avoiding places, people, or even things that will trigger them to whatever happened to them. So there'll be too much avoidance. They can have nightmares every time you're not relaxing. You just every time something happened, like you hear a gunshot, you like, oh, something happened to you. So these are the signs that somebody has been through traumatic experience. And if you've been through this, or these signs have been happening to you, most of them, they can happen to some people and all of them, or some cannot even happen to you. So if you've reached to a level that nothing is done to you, this is where, like, even after 3 months after you've experienced these signs, isolation, body changes, anger, avoidance, you're not able to relax, it is okay, guilt, shame, what after whatever happened. These are different reactions to different people. So this is somebody mentioned, honorable mention about PTSD, the post-traumatic stress disorder. When nothing is done to you, if it's reached to 3 months and nothing is done to you, this is where you can reach to a point where you'll not be able to control. You'll reach to a level where you can even commit suicide because nobody has been there for you, nothing has been done, and maybe your ability to solve your problem is not able to, you've not met it. So people who have been in traumatic events need to be taken care of, need to be around their relatives, people who they trust. You need to be around people who you'll be able to share your problem with, not people who will go and talk about it instead. So you need to build your relationship, trust relationship with the people around you. This is one thing that can help. And if you've also noticed that somebody is having those signs, you also need to take care, be around them. In our society today, people don't even care. People are so busy doing other things that they don't have time for other people. So when something happened to somebody, we need to be around them. This is emotional first aid. We are helping them to calm the brain for them to be back to their normal mental stability. So these are some of the things that we need to do. Something else in South Sudan now, if you have such behaviors, people are being imprisoned, which it's not the right thing. If you have such signs, you're not supposed to be in prison. You're a sick person. You're not supposed to be taken to a prison. You're not a criminal. So we don't, one of the things that can even lead to suicide, you go to the prison, you kill yourself tomorrow. So who has helped you? You're not helped. You're being put to another traumatic situation because you are sick. You're not a criminal. So these are some of the things. Parents today, instead of them taking their children for maybe mental health facilities, they are taking them to prisons. So we have our honorable here. She's now the Minister of Health. I think some of these things, they are going to work better. So that is one of the things. Providing basic needs for people who have been in traumatic situations. These are things like justice, things like safety. They are going to help people maybe to calm down when traumatic event happen to them. Thank you.
Wow, thank you so much. Well, talking about mental health and those that are assumed to be, mentally ill, taken, and taken for a punishment, because, I believe that these are correctional facilities for somebody who has done an offense, to be corrected, to be able to be integrated into the society once again. But when somebody is mentally ill and they're taken there, I think it's the worst that we can do as a nation. And also we need to look at that. And thank God here we have the Honorable, Minister of Health. I hope she is, noting these things and can be able to use her position to ensure that these people are actually, taken to the right correctional facilities as far as mental health is concerned. And I would give an example of recent, it's on record that a gentleman who was actually mentally ill was taken into prison, in one of the states. And so happens that he had a relative who was in charge of this facility, of this prison. So he decides to bring him to live with him at home. So this mentally ill prisoner in this context used to go to the facility, to the prison once in a while. So he happens to go this one day and then, goes with an axe and, kills 2 inmates. And unfortunately or fortunately, one of the prison wardens, shot him dead, but he left others injured and also 2 dead. So, and also the victim here who is imprisoned died as well. So these are 3 people dying, and yet we have to, save the country. And that is not really, really right. And that is why I think we are here today discussing mental health, for it is a human right and something that we need to take serious. Now, Ms. Nyamach, what do you think could be the approach, for South Sudanese as a community to use in dealing with people living with traumas? Because some people, it is hard to tell, what actually, one of, I think it was Lily or Yolanda, Honorable Yolanda said, domestic violence, is also one of the things that are bringing about mental health issues. So what do you think can be done, by people living around people that have traumas? Can you hear me? Oh, okay.
Yes. Okay, there's a Ms. Mrs. Lee, she wrote something that she's getting late for work. I think we can give her a chance.
Oh,
we continue with our discussion.
Oh yes. We actually coming to the end of our discussion. And that the mental health experts are facing in our communities, and what are your recommendations? Because I believe a doctor who is trying to treat patients also would need a doctor, because it's a process for mental health experts. I think you also do go through, mental health issues in the process of helping mental health patients or clients.
I did lost you a little bit. There was a time
Yeah, I
that
think,
like
yeah,
the whole
I
question.
didn't get you right. If you could go over, please.
Hey, can you hear me? Yes. So I'm asking Miss Lily what she thinks could be, what are some of the challenges facing mental health experts or people who are trying to support those that are having mental health issues, and what are your recommendations?
Yeah, hello?
I can hear you.
Yeah, do you mean the challenges? Are you hearing me?
Yes, yes, the
Okay.
challenges facing. Yeah.
You mean facing the mental health sector or individual? I didn't get you right. You were kind of cutting. I'm sorry.
Oh, I mean, what are some of the challenges that the mental health, the people and the community that is trying to help those that are having mental health related issues face?
Yeah, thank you so much, Joanne. There's a lot of challenges actually, especially with the, I will talk more of our community because I have more example with them. Um, in most cases, as we talked about it, it's very hard. Like I can be a provider. I provide the services and it's available to you. But if you don't come and seek the services, then I cannot force you, you know that. So that's a bit challenging to us. If they don't come out and say, this is the problem I have, or seek like the illness that they need, or get diagnosed and solve their problems, it's very hard for the provider to go out there and get them and force them to come in. It's just like in Arabic, bikalimu daiman galta bishul galamaita budo fi bahar. Lakin kan galamair mader ashrub moya, itama basro kero ashrub moya. So I know we really understand that meaning. So that's the proverb, which is, and that's the challenge, the most challenges. The other one is education. It's a big challenge. There's no awareness to our people, to our society about mental health. So this is the challenge that we need to break it. We need to go forward. We need awareness in our community. We need to tell our community that this is something which is happening and we need to do something about it. We have to accept it. It's a reality. We're not going to run away from it. We run, it to follow us. We run together with it. So training, education, again, we have fewer personality. If you look at our society, South Sudanese, we are very, very few. We are not very many out there. So that's another challenge, even if we have like our people needs us, but if we are the providers are not there, then it becomes a challenge to where do you go? Looking at South Sudan, like right now, I think the service is only in the city, which is the Juba. And look at the huge number out there. How many people are there suffering, struggling in the states, even outside of Juba? There are so many. You find there, we have so lovely one that we lose them. They're on the street. Then we call them Majanin base. But because they don't have where to go, they don't have services. They try, diamond gulde kujur, but demon fi kujur, at the end, they don't get better, you know? Then they come back, the next day you find somebody's already moving naked on the street just because they didn't get the service needed because there are no personality. So that's the big challenges that we need to work on. And my recommendation would be briefly that, dear friends and brothers and sisters, we need to educate ourselves. We start with ourselves. We need to take care of our mental health. If we don't take care of our mental health, we cannot help the next person. We cannot help our dear ones. We need to educate ourselves. We need to understand what is mental health to be able to help a friend or a dear one who's gone through that mental health. We need to be there for our community. I will give an example. 2 years ago, my coworker approached me at work and like, Lily, can you see this photo? I have this little girl in my family, but I've seen her on the Facebook. She has posted something. And I was like, can I see? I saw. And of course, this young girl, when she turned 19 and she was like, I'm done with my community, I'm going to get married. She got married and moved to another state. And she got disconnected from the family. But of course, nobody was checking on her. All of a sudden, she was posting funny stuff on the Facebook. And people ignore it, like, oh, she left us, she's not part of us. But this girl, the 2 years she was away from the community, she suffered a lot. And when just looking at the picture, I told him, please, man, if you love this girl, right now, if you have somebody at that state, send that person to look for where this girl is. Let the person go knock at the door, which they did, and they went and found the girl. The girl was already almost finished. They had to rescue her. They have to fly her to the state where we are. We had to take her to the hospital, and she was diagnosed. She was mentally sick. She was not doing good. And now she's doing good. She was taken to Spring Harbor and she's doing good. She's now rehabilitation. She's in the process of healing. So let's check on our loved one. Let's check on our friends. And it's not only when the person lives with you, even when the friend you have stayed for some couple of days, they have not seen, doesn't matter, doesn't cost you anything if you can just get a phone and call, find how that person is doing, ask how the person is doing. It will be better for us. Let's take care of ourselves. Let's accept the mental health in our community. It's a reality. It's like any other diseases that we treat. Let's take it serious in our community. Let's create awareness and let's love ourselves and respect our own families and friends in our community. That's all what I can leave you with. Thank you so much.
Thank you very much. Thank you very much. Miss Nyamoch, I think
to cut it short, I think I'm gonna sign out. I wish you all the best. Thank you so much. My word to Yolanda is, Yolanda, don't leave us behind. We are behind you. It's time for you to create more awareness. We need the hospital. We really need help. As a community, we are all looking unto you. As youth, as women, we are looking unto you. Don't leave us behind. You are our voice and we'll support you if you do the right thing. Thank you.
Thank you very much, Lily. We appreciate your time. Thank you for the knowledge, and we hope that you will be back here to share more light next time. Thank you very much.
Thank you too. Good day.
Thank you.
Good night. Bye.
Good night. All right. Yes, Ms. Nyamoch, I do believe as well that in your field, you have you face a number of challenges, and if you could, highlight a few of the challenges and your recommendations as we wind up this forum for today.
Okay. Thank you so much, Joanne. I'll just start with the first question that I didn't answer before. I would like to say something about it. When we talk about some of the approaches, we know, like in South Sudan right now, we just say South Sudanese are so resilient, which is true. Like we've been through a lot and we're still standing. We're bouncing back after hard times, and that's it. So I'll talk of cycle of violence. Somebody gave example of domestic violence before. So these are the things that it starts like from individual and then it goes all over the trauma. So let's say it happened like a woman and a husband fight, and later on the woman will go and beat the children, and then children will go and fight the neighbor children, and then the husband with the stress he goes and with the stress he goes to the office, find the boss, has a lot of issues. So this is how cycle of violence starts. So in one of our training, we have an example, a success story. We have one of our participants, she's a woman from Blue Nile. So we always give a session of 5 days. So the first day, the woman never said anything in the session. And she just came, she talked, she was hearing what is trauma, causes of trauma, and all these things. Second day, third day, and then on the fourth day, when we were sharing about our, there's something we call hope. We're talking about a symbol of hope. So what happened to her? She came with the baby, the little boy, and then he said, "This is I want to talk something about this baby." What the woman said is like, when she has been coming for the training for the last 4 days, she has been hearing like this is her life. This training has been talking to her mostly because it's trauma, and this is what she's facing every day. So what happened? She said every day when she goes home, she beats the baby. She beats that child every day because they have issues with the husband. So when she went home for that 4th day of the training, she just sat there. She never beat the baby. And the boy came and asked her, "Mom, why are you not beating me today?" And the mother started crying like, "My son, I've been beating you because I'm traumatized." So we see this thing, this child is going also to have trauma because of because the mother is traumatized and the child is also traumatized. He's not going to be in peace. Even in school, he's going to fight his colleagues and the friends there. So trauma is just something that can be carried from one person to the other, just like that. So some of approaches we can do, or people living with people with trauma in South Sudan, things we need to do. First, somebody talk of self-care. We need to take care of ourselves. It starts with you being resilient. You need to take care of others too. If I'm not traumatized, I'll be able to live with people in a peaceful manner. I'll be able to know my limits. I'll not hurt other people. So this is one of the things. South Sudanese are idle at the moment, and when we're not doing anything, we'll be able to do harmful things. So what we need to do is we need to engage people. If people need to be creative, innovative, we need to do things that will keep us focused. So because when we are traumatized, we'll not be able to reach our full potential. So we'll not be able to be productive. What we need is us to be able to get out of this disease and be able to be productive, provide for ourselves, our loved one, in the environment, our community, be able to help other people. So this is one of the things that I wanted to add. So on the challenges, mostly we face a lot of challenges. First of all, as the national NGOs, we're having issues with funding, constrained budget. We're not able to reach where people out there because there's no much support. UN agencies, international NGOs, they are doing some part of the mental health, but they're not giving it as a whole. It's just a small cross-cutting issues like the MHPSS with the IOM and UNICEF. It's not that much that it's covering. I'm working with a national NGO. It's called Trauma Awareness and Trauma Healing and Resilient Alliance. These are 5 local NGO that came together. We are doing the trauma awareness all over the 10 states in South Sudan. And the impact is really making sense. If you go out there and ask about TAR, people will tell you in the field. So the challenges that we face are we need support. We need this local NGO to be empowered for us to be able to reach people on the ground and be able to provide much and give people awareness. Like, this is what we are facing. This is like somebody said, it's just like malaria. So if we are given how to take care of yourself, malaria, you need to sleep under mosquito net. So with the trauma, what are you supposed to do? Take care of yourself, do some exercise, go to church, pray. If you're doing the yoga, all these things, these are the awareness that we need to give people to take care of themselves for us to be in this peaceful environment that we all desire. So that is one of the things that we also need to do. Some of another challenge that we always face in the field is in our South Sudan, we have some harmful traditional practices that are enable us to share our stories. It's all about you telling us what you've been through openly. You're not forced to talk. So it's even hard for women. Women are not open, like the stereotype somebody talked about before. Women are not given chances. They are so shy. They are going through a lot, but people feel like if I talk about my problem, what will people think about me? I was raped. So if I talk about me being raped, what the community will say, I'm like this and I'm like that. So part of trauma healing is you talking, tell your story, something that it's hurting you inside, talk it out. So we face challenges on people not willing to talk what is hurting them. So we really encourage people to talk, share their stories, what they've been through, to people, not just anybody, people you feel like you trust, not people who think they are going to expose you tomorrow or any other thing. So that's what I'd like to add on it. And yes, thank you.
Well, thank you very much, for that elaboration of those things that, they're trying to help those with traumas are going through. Well, we are actually at the end of this discussion. Maybe what would be your last word to the audience? What would you say to them as we sign out?
Okay, yeah, thank you. I think I've said much, but what I will maybe insist to say is self-care. There's another form of trauma that is called compassionate fatigue. You might be outside there, you're serving, you're working for your family, you're doing a lot of things, but you're forgetting to take care of yourself. So that is another kind of form of trauma that might affect you in the future. So what I'll tell people outside there, it starts with you. Think about your individual. Are you peaceful with yourself? The things you're doing right there, are they the right things? Are you reaching your full potential, or there's something that is limiting you? Is it trauma? Is it mental health? Is it anything? So please take care of yourself, take care of your families, take care of your people around you. Let us take care of our communities. Do something that make change to us. Let us all be change makers. Let us transform our communities at whatever level that you're managing it. Thank you.
Oh, thank you so much. I want to take this opportunity to appreciate all our panelists for the day. We apologize, two of our panelists were not able to be with us because of technical issues, but we hope that next time, the South Sudanese Women Intellectual Forum will bring them forth for a discussion on mental health and other related issues. I also want to take this opportunity to appreciate our audience for your patience and for taking your time to listen to mental health. And we hope that you shall be ambassadors of mental health in your societies and communities. For the goal here is to create awareness on mental health and also to support our people, especially the youth who are going through a lot as far as mental health is concerned. Well, we also want to thank our biggest support, the UN Women, for supporting this forum, the South Sudanese Women Intellectuals Forum. Thank you so much for what you are doing, and we hope that you shall continue to support, the South Sudanese Women Intellectuals Forum and all the activities that they are doing in the country. Thanks so much, and I think we can call that a day. Have the best of your evening, morning, and afternoon, wherever you are. And don't forget, mental health is a human right. Thank you so much. Bye, Nyamach.